Welcome to the Reflect On podcast, where we embark on inspiring conversations filled with truth, vulnerability, and, well, anything else that'll help us learn, grow, and live better lives. I'm your host, Kevin P. Murphy. Thank you so much for embarking on this reflection journey with me today. Now let's get right into it. Dr. Taylor Thurston is a naturopathic doctor that has had an inspiring journey. Perhaps the most inspiring part of that journey is that she has opened up about her seemingly negative mental health experiences and turns them into a superpower so she can help herself, her patients, and other people around her. We discuss how vulnerability, contrary to popular belief, is strong, but also scary. We also reflect on the current graces, challenges, and opportunities that we have in developed healthcare systems, and that some of the best ways to help yourself is to help those around you. Dr. Thurston also shares her thoughts on the prevention versus treatment methodologies and her opinion on what the one single most important aspect is for holistic well-being. I think you're really going to enjoy this episode. As always, thank you for spending time with us and enjoy this episode with Dr. Taylor Thurston. So I was curious, actually, I was thinking about what to ask you. And
Yeah.
one of the things I thought about first was you are, to me, an interesting case of a doctor who isn't afraid to share their previous experiences. That to me is so unique in today's world. So it has to be, I would imagine, more rewarding for your patients to understand that camaraderie and that safety and things like that. But what do you think when you reflect back on that journey, whether it was when you were going through all those struggles before, or or the struggles you're going through still today? What do you think are the biggest ones you've overcome or are trying to overcome?
Yeah, that's a great question. I feel like what I get a lot in terms of questions, especially for somebody who's, been in the shoes of a lot of the patients that I see, I think one of the more common ones is like, how did you get out of it? Because when you're in it, it can feel like it's never ending. Anyone has experienced, small bits of mental health struggles, but when you're in a negative funk or you're in a bad spot, it can really feel like it will never end. I think the biggest thing, honestly, that I found to be the most helpful is talking about my story and telling people about it, because I was so afraid to even ask for help in the first place. And when I did, I was so discouraged. But it was finding the right people to tell about it and like explain what was going on in my head, and that we actually all feel like this a lot in different times of our lives, and maybe some are a little bit more, severe or debilitating than others. But I think that, as unfortunate as this sounded, it is part of the human experience. And then being able to lean on the people in your life for support and knowing that they've also gone through struggles as well was probably the best way that I feel like I improved and then was able to show vulnerability to the world, because it's not easy. And you have to feel safe doing that, because I know for some people they have, and it's kind of going sideways. So just making sure, you're saying it to the right people. But in terms of what I feel like I've overcome is probably accepting that it is part of the human experience to feel like shit sometimes. And I feel like I was always questioning why I felt that way. And through a lot of my like mindfulness meditation practice, I've realized that, the more we resist, the more it persists, unfortunately. So leaning into the idea that, if we can accept the way we're feeling and actually deal with it, it might actually get better. I think the concept of like, when I was in my darkest, I think I would say that what I've overcome is that life's really impermanent. So there's always going to be that up and down flow of things, but I never feel like I want to not be here anymore. I think that that's obviously a huge piece that comes with quite debilitating depression. And then the things that I feel like I struggle with still to this day, that's a tough question because I feel like there's still so much that I need to learn and grow with, but I feel like leaning into the idea that, I mean, for me as a practitioner, that I can't help everybody, and that there's still quite a lot of bad stuff in the world that really debilitates people's mental health. But personally, I feel like just to be a lot more patient with myself and that I can't know everything, I think is definitely one thing that I feel like I will forever struggle with. Yeah.
Well, I love how you entered that. Sorry, I love how you ended that rather, because one of the things that I was thinking about before I thought about that question to ask you was I used the word overcome. And to me, it's not a light switch, right? It's not something you just reach a mountaintop and then, okay, like I don't have any more issues anymore, right? I'm
Nope.
never gonna worry about the fear of judgment of others or anything like that. And it's a perpetual journey almost, it seems like. I also thought it was great that you answered. I'm curious about when that point you started to talk to others. It sounds like you started to go to clinicians or professionals or other doctors and things like that. I'm curious with your experience, was there things that were holding you back from talking to those closest to you, and if so, why?
Um, if anyone is listening that's an athlete, they can definitely resonate with this, but I've played high level sports my whole life and think as much as I have learned so much from being an athlete, I think it may have come with some downfalls of,
Wow.
you put your head down and you get through things and you tough it out, really. And yeah, that's great for certain things. It has definitely driven me to be where I am today. But when it comes to your mental emotional health, that's not helpful to fight against it, kind of what I was saying earlier with resisting it. But I think that was the biggest factor of it feeling like a weakness. Like it felt like if I told everyone, people would treat me differently. I remember actually quite vividly, I was visiting a friend actually in Queens, and I was in my car and I don't know why, but I had a panic attack, so I had to pull over. Ended up kind of fainting, and it's not
Wow.
funny, but I just remember this so vividly and being like, I'm going to be late for hockey, which perpetuated the panic attack because we had a strict rule on our team, can't be late. And I remember having to tell my coach about it. And so I remember, I'm pretty sure it was like my mom was involved somehow and was like, you have to tell your coach what's going on. And that was when I think that things started to open up for me in the sense that like people aren't going to treat you differently. And so the biggest thing I feel like for an athlete was like, it wasn't that they weren't going to support me. It was that they were going to treat me differently. They were going to be like, are you okay? Like, do we need to spend more time with you and all those types of things. So I feel like that probably is the biggest reason I never reached out earlier, never shared my story or like got help when I needed earlier.
You're kind of hovering on something I really believe in as well, which is the fact that you said the phrase tough it out. And you said the
Yeah.
phrase, approaching it and almost as if being looked upon as if you were broken.
Right.
But I think what's really interesting is that I think vulnerability is more strength equates to more strength. And we have a culture that, in most places, we have a culture that almost thinks the exact opposite, and it's been cultured into us for our entire lives, right? Whether you're a standard male, as an example, or you're an athlete like yourself, or anything in between, anyone. if you're trying to perform at a high level and you're trying to look the best for people, it seems like we think that if we're vulnerable, that makes us more broken.
Right. Yeah.
How how did you actually flip that switch in regards to understanding, if you agree with that, of course,
Yeah.
how did you flip that switch to understand that, okay, being more vulnerable actually makes me stronger? Was it the first time you did it and realized the repercussions and that people aren't going to judge you as much as you thought? Or tell me more about how that worked for you.
Yeah. I feel like vulnerability is one of those things where when you're when you don't it doesn't actually feel courageous when you're doing it. So sometimes it takes a long time to realize that, showing up that way and telling your story is courageous. So
Hmm.
I feel like at the time I had no idea and I was scared shitless, to be honest.
Yeah.
And so I guess looking back on it now, I'm not really sure what switched. I think maybe over time I realized how many other people were also experiencing it.
Hmm.
And it felt like, I wasn't broken or I wasn't alone in that, and that a lot of
Hmm.
people share that experience. And vulnerability is funny because I feel like for a lot of people, it doesn't feel courageous when you do it. It actually feels not good until
Hmm.
maybe later on, where you
Hmm.
can get the support or whatever ends up happening from that vulnerability. Like, but vulnerability is scary. And it's often like very, very uncomfortable.
Hmm.
So I don't know if I have a specific answer in terms of like where that switch happened, but I
Hmm.
guess I opened up in probably in the last situation. I'm like, well, with heck with it, like I'll just try and
Hmm.
see what happens. And then I think that grew the conversation within like my support team and even my close group of friends. And then I've just kind of felt like that's the part that's been missing for a lot of people. So I do my best to share and be as authentic as I can, because I feel like a lot of people try and hide behind things. And especially like as a doctor or as like athletes, like there's more people coming out, and it just shows, general populations that it's okay to also be in that same position as well. Yeah, but I don't know that I have a little switch of a moment, but that's a good question.
It's an incredible answer nonetheless. You mentioned, I love how your story bled you into actually pursuing something that you really think, at least from my opinion and looking outside, and you can correct me if I'm wrong here, but it looks like that call to service for you in regards to helping people understand similar journeys that you went on yourself and are continuing to go on is something that has potentially helped you even more personally, looking outward, helping others and things like that. And I've listened a lot and learned a lot that when we look outward and actually try to see the problems of the world or see the problems of others potentially, instead of focusing so much on ourselves, whether it's beating ourselves up or negative connotations or things like that, it actually kind of heals some of it unknowingly,
Mm-hmm.
almost, right?
Yeah.
But you mentioned that inspiration to start sort of your practice. So I'm curious, since you've started and you've really been treating patients regularly, what would you say are the 2 to 3 or a couple of items that are the most surprising to you from your clients and your patients?
In terms of how they feel, or what do you mean by that?
Really anything. Ultimately, what they express to you, obviously keeping
Mm.
confidentiality
Yeah, of
front and
course.
center,
Yeah.
of course. But what they express to you, what problems you learned
Mm.
about that you didn't realize were connected. Like one of the things I love of what you do is that you really, obviously you're a naturopathic doctor, but you really look at things in a holistic manner. You don't
Mm-hmm.
just you're willing to explore, you're willing to be open, you're willing to learn other facets beyond just what your degree got you and your current, your studies did. what have you learned that from your patients that you think has been the biggest surprise to you since you've started?
Hmm. I was telling someone this the other day. I maybe not answering the question fully, but I think as a someone in the medical world, what I've actually found to be the most frustrating
Mm,
is just how little we've learned in school to help us support our mental health, and how many issues could probably have been better managed, controlled, solved if we learn to manage our emotions, our thoughts, our finances, the things that are important to being an adult.
mm-hmm,
And I guess that doesn't fully answer your question, but I think that what I'm trying to say is that what people are looking for support for their mental health is usually not something that can be done really quickly. And
mm-hmm,
so as much as like supplements and diet and medications and all the aspects, all the multifactorial aspects of treating a mental health disorder, I think it all comes down to where what has happened in our life in terms of trauma, and what adverse events have kind of shaped us to be how we are, and how
mm-hmm,
that has wired us to be a certain way, and just through our lens of which we see the world. But the biggest thing I find is like so many people have built up things in their mind because we were never taught how to deal with
mm-hmm,
difficult stuff. And like that's the shit that makes people go kind of nuts, because we don't know how to deal with our emotions that are so powerful. We don't know how to have difficult conversations. We don't know how to maintain and be in healthy relationships and
mm-hmm.
develop good boundaries. So I feel like that actually has been the most profound thing I've noticed, that is both frustrating and eye-opening at the same time. And that, I mean, that's a big reason why I want to and will be doing some mindfulness-based therapies and stuff in group programs. But I think that that's a frustration, but an eye-opening piece that I've found a lot with patients. Is just like how it's not, and it's no one's fault. It's
Mm-hmm.
just unfortunate the way, like, I mean, at least we can play a recorder and do calculus, but I guess it's just not overly helpful, I find, in the real day-to-day struggles that most adults face. So
That's so funny. I said this actually earlier today to someone. I'm really happy we learned about parallelograms and not how to do our taxes in high
yeah,
school,
yeah,
or
that
in grade
too.
school and stuff too,
Yeah,
right?
yeah.
It's I saw it on a meme like a very, very long time ago, and I have a bias just because I'm in the financial world, but
Oh, hilarious. Yeah.
it's it's I couldn't agree more, honestly. And I love how you're really thinking of things as in the function, like I see it, and I could be wrong, but in the functional medicine approach, where it's the body is an ecosystem. It's it's not. It's important to reflect back on what, like you said, all the different things that have made us who we are today, to understand them. And
Yeah.
I feel like a lot of us don't even do the first step of that. But to your point, because we haven't been cultured or haven't learned how to do it at all, and we think it's scary, and we think it's wrong, we think it's not strong as well,
Yeah.
right?
Yeah.
And it's really interesting how your practice is kind of seemingly meeting like psychotherapy with naturopathic medicine. It's like it's incredible. I haven't actually seen anything like it. I could be wrong. Like I don't know if there's a lot of things out there like it, but it that I think that's why it's so inspiring. Honestly, I really do.
Yeah, like there's definitely people that have dual training, but I actually will say that that's something and someone that I often always refer patients to see someone who has additional training in therapy, because they've had extensively more, certifications and education on that piece, and I work
Hmm.
very heavy-handedly with those practitioners to get the best care and treatment out of people. But yeah, I think addressing all of those aspects and having like people on your team that will address all of those aspects is super important too. But yeah.
Sorry, you made me curious about another question too. When we think about,
Mhm.
we've talked a lot about sort of how we've been cultured or what we've learned, and whether it's through our school system or medical system or whatever it is, without obviously stepping on too many toes, so to speak. But I think it's
Yeah.
really important to hear a raw and honest opinion from you. What do you think are some of the most misunderstood things about our current healthcare system?
I want to get too in trouble here.
Hence
Yeah.
the preview to the question.
Yeah, I would say before I guess answer the question is that I do feel like people are doing their best, and it is a
Yeah.
system that has been set in place for a very long time.
Hmm.
And generally speaking, we are very privileged to have free healthcare. There's a significant amount of benefit
Hmm.
to our healthcare system. And I genuinely do believe that everyone is trying to do good. That is how I will, preview that question. But for the most part, I will say that the system isn't designed for prevention. It isn't designed for chronic illness. And I think that that is where, conventional care really has its downfalls.
Hmm.
So when I say that, I'm essentially referring to the very small amount of time you have with your doctor. It's very symptom based, where this is the symptom, this is the medication. I do think medications are profound. They need to be there, but there's a million other things associated with most health conditions. I would say like our hospital is incredible in terms of like you have an emergency, you go to the ER, those types of things. I do feel like it's not built for illnesses that have been around for a long time, that are multifaceted, that are mental, emotional based sometimes. But
Hmm.
I do think that um, a lot of it is that most of the healthcare system's understaffed and overworked.
Right.
And for the most part, many people within that system are underpaid and undervalued. So there's lots of issues there, but I will say that where I think like naturopathic medicine shines, is things that, have been around for a long time, that have many different factors. And ideally, everybody would have, a family doctor, which is a big issue in BC, but family doctor and ND, you have all those people and
Hmm.
it's all covered. But that's a conversation for another day. But essentially, that's where I feel like it can have the most downfalls, when we're talking about like long-term conditions.
I tend to agree just in the sense that there's no value in placing blame on people, really.
Right.
There's a value in trying to learn and grow and evolve the system
Mm-hmm.
to treat more of the things that we've understood as a society more, right? That are
Yeah.
chronic problems. But I really like how you mentioned the fact that it's not as if and one thing I thought about actually when you said that was if you think about a nurse or a doctor, like who's helping them? Everyone focuses seemingly, again, just my opinion, but a lot of people focus on, okay, what is the care they're providing? But I've learned this even through my own role is I can't, unless I value my own life enough, I can't be the best person for my partner, for my family, for my friends, let alone all my clients or
Right.
patients or whoever you
Yeah.
work with. So
Yeah.
who's helping them is a question that may not be asked enough.
Yeah, you bring up a really good thing that I talk about all the time, but like you can't you have to fill your bucket up first for sure. But like the amount of burnout and stress and all the other things that have happened for many doctors and nurses all over the world,
Hmm.
especially in the last 2 years, just showed how, maybe how little we actually provide them with assistance, rather than them giving everything to us. And I feel like that has shown and, has been really highlighted over the last few years with COVID.
Yeah, no, it's well said. I think another thing, I'm going to guess that you've read about this, maybe have contemplated this idealism as well. But I think another thing the last couple of years has maybe shown us is how we really need to focus on more than just a few factors in prevention or symptom treating, as opposed to our overall health. as an
Mm-hmm.
individual. I mean, the verbiage treatment versus prevention, when you hear that, what comes to mind for you, treatment versus prevention?
That speaks very directly to the principles of naturopathic medicine, which we tend to try and follow.
Mm-hmm.
But one of them is prevention. So I definitely feel like I went into naturopathic medicine for that reason. And that, yes, there's a lot of conditions that we can't fully prevent, but there's a significant amount of conditions that we can do a whole heck of a lot of
Mm-hmm.
before they ever develop that way. And so I guess that's not to put blame on people who developed certain
Of course.
conditions, of course, but I feel like, and I don't know that I don't know, this is tough sometimes, but I feel like it's a combination of, yes, it's your responsibility as a person to want to care for your health, but there's a whole system set in place that also is supposed to take care of you. And I
Mm-hmm.
feel like that's maybe where we need more support rather than supporting on the individual level, because for most people, healthcare, they didn't go to school for science, they didn't go to school for healthcare. So to put that on them to figure it out on their own, it goes back to what we learned in high school. Like, we didn't take a class on nutrition, or like you could drop out of exercise or whatever in grade, I don't even know, like super
Mm-hmm.
early. So those types of things that I feel like our system maybe sets some people up for poor health outcomes rather than putting all the emphasis on an individual. But yeah, I do feel like, especially with COVID, there's an element of prevention there. Obviously, people got COVID when they were normally healthy, and things not like very unfortunate situations happen. But
Of
for the
course.
most part, a lot of it was worsened significantly by, the poorer your health was, often the worse outcomes you had if you developed COVID. But
Mm-hmm.
yes, I definitely believe strongly in whatever we can do to either prevent it from overtaking your whole life, or even just to prevent it from developing in the first place, is huge.
This is going to actually go against a lot of the things we've been talking about, but I'm just curious for you. You think of emotional health and how we treat that, or all facets of health rather. You think of the preventional measures that we have each day that we can work on. So diet, sleep,
Mm-hmm.
exercise, vulnerability, social connection, whatever that, community, service, whatever those
Yep.
might be. If you had to pick one, like I said, this goes against everything we talked about, but if you had to pick
Mm.
one, what would you say is the most important?
Oh my gosh. If you could only have one of those elements, I would say social connection. I think because you could, I don't know. That's a really hard question, but I would say, like, if I'm thinking about all of those faceted, you could eat the best, like have the best sleep, like you could be really healthy and also alone and have no connection. And I feel like that is just human instinct, like that's
Mm-hmm.
innate to us. And so without support and without communities, and I actually see this in practice, like the
Right.
ones without that social support, the ones who've moved from different countries and now they're alone here trying to figure it all out, they're doing everything and
Mm-hmm.
they are isolated and alone. And I feel like, if anything, we can just look back on the pandemic to know that alone, with like the isolation that people feel. I think, yeah, I think social connection and community would probably be my number one.
Wow, that's incredible.
I don't know.
Um,
What do you think?
that's a good question. I think almost in a way of cheating the question, I think that answer, so like social connection, community, belonging, sense of belonging,
Mm-hmm.
that can really be a foundation for all the other facets. So I'm
Right.
gonna stick to that answer in a sense of
Okay.
cheating because it
Yeah.
obviously that's a hack. So
Yeah, all
but
good.
it's a wonderful, wonderful good answer. I have a couple of final questions,
Yeah.
but before we get to them, I want to acknowledge to you and what you do. It's incredible how, like I said at the beginning, you've become someone that is gone on a journey yourself, and more importantly, willing to share that journey to use it as an act of service. I think that's the catalyst that sets you apart from a lot of people. The vulnerability, the willingness to understand, truly be empathetic with clients. When I say that, I mean, I think of empathy, I think go into their shoes. So I just want to acknowledge you. It's really inspiring what you're doing. So thank you for it. And don't stop.
Thank you so much for the kind words. I really appreciate that.
Of course, yeah. So this question's an interesting one. It's called Wisdom Bites. Okay. So I want you to take a moment and think about all of the wisdom that you've accumulated. Incredibly hard to contemplate, of course, but I want you to think about all of the learnings that you've had, the mistakes, the failures, the triumphs, the joys, what you've learned from all of that. Now I want you to forget it and not remember anything. And imagine that moving forward, you could only live by 3 pieces of wisdom, 3 mantras, 3 pieces of wisdom. What would those 3 wisdom bites be?
See, this is where I would love the questions beforehand. I think the idea that life is impermanent will be a very big one on mine, because your highs will leave, your really low lows will also leave, and it's forever changing. And the idea that those moments that you have will come and go, and you will never have them again. So I feel like that may wrap up my 3, because I could relate it to a lot of things, especially with like people in your life, moments in your life, like they will come and they will go. And to make sure that people know how you feel about them is a big one, because life is impermanent and it's damn short. So just making sure people know how you feel about them, really trying to live in the moment, whether that's through shitty storms or the best day of your life. I'm trying to think of other 2, but I think that kind of encompasses one of the biggest like wisdoms that I've gained over even my, my best times in my life and my worst.
Wow, that's powerful. That's okay that you only had 1. It's a pretty powerful one. So
reflect on that one.
Yeah, interestingly, it actually leads me to almost my final question. But before that, I want to ask how else I can support you. So I know obviously you're Dr. Taylor Thurston on Instagram, drtaylorthurston.com, if I'm not mistaken. Supporting you there on the platforms, learning more. You do an incredible amount of education. You've taught me a lot, and it's amazing that you've done that without even connecting directly with you. So it is very, very powerful. How else can I support you?
I mean, I think the things that you're doing with like bringing on people that will help other people to learn. But one thing that I can say is I feel like these types of things, I feel very supported in, but your support through my social media is probably the best place to. And then because I'm practicing in BC, I can't take on patients outside of that province. But when I start running workshops and, mindfulness meditation things, and that can be something that we promote through people from Ontario.
Of course. Yeah. I think the more people it gets out to, the more people you're helping, right? So I think that's beautiful. So you actually mentioned it at the answer of your last question. You said you needed to reflect on it a little bit more. And it's my final question. What is one thing you should reflect on more?
I would say this goes for myself, but also everyone listening to this, that everyone, including myself, should reflect on the good things in their life and the good things that they have accomplished, because we shit on ourselves enough that as much as we can, to reflect on all the goods that have happened, and also like how far we've come to be where we are today.
Thank you very much for spending time with me on the Reflect On podcast today. If you found this episode enjoyable or inspiring, please share it with those who it may help, and leave a positive review so that we can grow together. Until next time, reflect onward, and keep moving forward.